Hi everyone. Question for you. If you're as a clinician, you're used to educating people about their risk factors when when they have a chronic condition or when they're vulnerable, like people with heart failure. If you have someone with heart failure on your caseload, you're going to feel that educating them about their risk factors is something that's within your care plan, right? So, say for example, if you have someone with heart failure and they're a smoker, you're going to educate them that that's not going to be good for their overall outcomes, or if they've got a crappy diet, or if they don't exercise. These are things that as clinicians, it's part of our job to teach our patients, not just like to do the exercise, but also this is what you want to do to have a more healthful lifestyle. Okay, so what if I told you that there is one risk factor that is linked to 4 times more mortality, so more than 4 times going to be like dying in the future. It's also linked to 70% more rehospitalizations and 60% more emergency room visits. That's a pretty powerful risk factor, right? Is this something that you should include in your care plan? I'm going to give you a clue. It's not smoking. This risk factor is loneliness and social isolation. There's a lot of research out there that shows that people who have heart failure and who feel lonely, who feel socially isolated, are that much more likely to have mortality, to be rehospitalized, and to seek more medication, more ER visits. It's a big, powerful indicator of their overall outcomes. But this is one of those risk factors that isn't being addressed by many clinicians. Is it the physician's job? Is it the nurse's job? Is it the therapist's job? And how do we do it even if it is our job? I will be the first to put my hand up and say this is not something I've addressed before with my patients who have heart failure. I'm an occupational therapist. I work in acute rehab, so how would I even go about that, like including that in my plan of care? But this is something that we should be mindful of. So, when I have someone with heart failure, what I'm going to do is, while I'm educating them about their other risk factors, eat better, don't smoke, do your exercise, I'm also going to say, engaging with people and engaging with your community is also something that is going to have a profound effect on your health, and really work around how to get on that with them. This is one of the things that we've learned from this pandemic. We can think outside the box in terms of connecting with our communities. So I think it would be worth thinking about how you could include this in your plan of care. Like, could you have one of your goals be teaching your patient how to use FaceTime? That could be a good goal, and a lot of our patients don't know how to do it. Or teaching them how to engage in their community, like making a specific goal of wherever they need to be, church, grocery store, whatever, how they're going to engage, or showing them how to seek community online. Facebook, of course, like this medium, look at us connecting right now, or online support groups on Facebook are a huge source of community and support, the questions that people can ask and engage with. So I think that when we're talking about kind of making our care plan as relevant as possible to someone with heart failure, we should really be thinking about these things as well, because we can teach them a home exercise program. Of course we can. Maybe they'll do it. I'll try to be optimistic. But honestly, if you thought that this one thing could be as powerful as that, I feel like we can't turn our backs on that. Once you know that this is a powerful indicator of how they're going to get along, I think it's worth thinking about maybe shifting our care plans ever so slightly to include community engagement or decreasing social isolation. So our lovely Ruth wrote a good article on this, which I'm going to link to in the thing below if you want to read more about it. But today I'm going to challenge you to think a little bit differently about how you treat patients with heart failure, and maybe how you would include this in your plan of care. Thanks for listening. Bye.